countries with the lowest seafood have the highest rates, and this is more than a 50-fold difference across the extremes of intake. The reason I ask this question is that mothers give over omega-3 fatty acids and other critical brain nutrients from their own bodies for the sake of their babies' developing brains. This broad epidemiological data across country fits that hypothesis with a tight R square and a tight p-value. When we go on to look at highly detailed data in the Alsbach study, looking at the omega-3 fatty acids from fish, that's 15,000 children and 15,000 pregnancies enrolled and following from the children. Among the mothers, the less seafood that they consumed, again, there was a greater risk of the prevalence of postpartum depressive symptoms, and there was a dose response effect, even adjusting for covariates. And then moving on to the tyranny of meta-analyses of randomized placebo-controlled trials. This is one meta-analysis done by Zhang with 8 eligible randomized trials, including 638 participants. And there was a significant effect of omega-3 long-chain fatty acids on reducing perinatal depression, with a higher ratio of EPA to DHA, showing significant efficacy, no evidence of publication bias. Those findings are, Zhang findings, suggested that omega-3s will significantly improve depressive symptoms in perinatal women, regardless of being pregnant or in the postpartum, and it's well tolerated, certainly better than pharmaceuticals. And furthermore, that the omega-3 response was linked to higher EPA in the formula. A second meta-analysis was done by Mocking et al., taking data from 18 trials and 4,000 participants. Critically, in depressed women, the omega-3 PUFAs showed a medium effect on depressed women, but shockingly no effect of reducing depression in women that didn't have depression. This is actually a common thing that has occurred in intervention trials of omega-3s, is that people without depression are enrolled in the trials, and shockingly enough, their depression doesn't get reduced by the omega-3s. That sounds simple and stupid, but then those trials of people who didn't have depression in the first place are added into most meta-analyses, and it dilutes the effect of the omega-3s. Mocking et al. States here that, moreover, the effect was medium to large in postpartum women with depression as compared to a negligible effect during pregnancy. So they concluded that their meta-analysis consolidates the importance of omega-3 PUFAs in perinatal depression, and that there is a significant beneficial effect in perinatal depression with subgroup differences as discussed, and that nutritional medicine is an important strategy to treat depression.